That's best. That's as best as we can put them.
And what would those be?
Definitely vegetables, fruits, milk, which is said to be high in calcium and vitamin D. You know, those are meals that foods that will always protect you from developing colorectal cancer.
Fruits, vegetables,
yes,
milk, food high in
fiber,
vitamin D. Okay, we are getting a phone call from Sunday in Kaduna. Hello, Sunday.
Hello, good afternoon.
Hello, Sunday.
Hello, good afternoon.
Good afternoon, Sunday. What's your question?
My question I want to ask you, doctor, what are the signs? Hello?
We can hear you, Sunday. We can hear you.
Hello?
Go on.
Hello?
I think we...
Oh, can you hear me?
Yes, we can. I think we lost Sunday there. Okay. So what kind of equipment do we actually have right now within the country that can help with detection, screening, and all that?
I think we have enough, more than enough, if I may say.
We don't need to be scared that we don't have virtual colonoscopy.
No,
or
that's
something
just
like
esoteric. I mean, we have the basic colonoscopy equipment, sigmoidoscopy and colonoscopy. They are available in virtually every teaching hospital. I can say that for sure. They are available in a few private hospitals too. You know, maybe one or two general hospitals too can boast of having a scope. You know, so at least it's within reach. It's not beyond our reach. That's the truth. So, and then of course, the stool. Sorry to cut you. The stool test is.
That's always
always available. You know.
But people wouldn't be too sure. You know that.
Every
test would be.
Every lab should be able to do a stool test.
And with the stool test, you can absolutely be sure that
you don't have.
Well, you are sure with the stool test
yes.
that there's bleeding or there's no bleeding.
Yes.
But you can't exactly tell what the bleeding is about.
If there's bleeding, you can't say for sure what it is due to. So you have to investigate further.
Further
yes.
tests. Okay. With the way you're talking now, it looks like we don't actually have to deal with this colorectal cancer at all. Is that right? Can it be eliminated?
Well, to a large extent, it can be minimized, you know, if people do their routine checks and it's detected early and nipped in the bud, then we don't have to deal with the burden of the cancer itself in its advanced stage.
So almost 100% reduction in the burden.
I am always afraid to say absolute figures.
You know, because people just think once you mention cancer, it's like, well, begin to prepare your will, you know. Anything could happen. You could drop any moment and there's going to be a lot of pain before you die.
Only true
so it's really refreshing to hear that you could just clip a polyp and be done with it. But by the way, does it recur? Is it something that you can say, okay, we've clipped all the polyps, this person isn't going to get cancer?
Well, it may recur. That's the truth. You know, it may recur, but then it can be free for years, even before a recurrence.
We're having David from Lagos. Hello, David. Let's just see if we can get this in. Hello, David.
Hello?
Please, your question.
Yeah, I can hear you.
Go on with your question, David.
Okay. I would like to know the difference between colorectal cancer and prostate cancer, please.
Difference between colorectal and prostate.
I would like to know the difference between. I can hear you. I would like to know the difference between colorectal cancer and prostate cancer.
Yes, we heard you. We'll attend to that right now. What's the difference between colorectal cancer and prostate cancer?
Okay. Well, colorectal cancer is cancer of the large bowels, whereas prostate cancer is cancer of the prostate. Prostate is a male organ, usually lying beneath the urinary bladder in men. So that's the difference, basically.
Okay. Let me go back for a minute to bowel movement. You said that bowel movement changes, could change as one of the symptoms of the cancer. Does frequent bowel movement have anything to do with maybe, let me put it this way, is frequent bowel movement a good thing for the prevention of cancer? Because some people say they don't go, normally don't even go move their bowel for a week. And to them, that's normal. So the question I'm asking is, should it be a frequent thing?
Okay. Well, frequent bowel motion or movement is an advantage. Because some of these foods that we mentioned earlier, the red meat, the fat diet, what usually happens is that the longer they stay in the large bowels, the longer the bacteria in the large bowels are able to process them, decay them into harmful substances that could trigger the malignant change or the cancerous changes we're talking about. So the shorter the transit time of the process of the digest food, the safer it is for the lining of the large bowels.
So in other words, more frequent bowel movement, better for you. Less breakdown, less malignant substances within the bowel. Okay. Thank you very much, Doctor, for coming on the show.
Thank you very much for having me.
We are very glad to have you. And thanks for letting us be a part of your day. Have a nice day. I am Mary Alale Yusuf.